almost there. Okay, and we are live. Hello, web shadowers. Welcome to the first session for our summer week 3. Just as a reminder, if you haven't attended a session yet, we'll be hosting 1 to 2 sessions a week on Tuesdays and Thursdays in the evening for our summer semester of web shadowers. We're very excited and want to thank you all for joining this evening. With that being said, today we have the pleasure of hosting Dr. Alyssa Cole, who will be teaching us about PM&R. And as always, please remember that the Google form will be posted in the chat box and in the description of this video at the end of the session. With that being said, Dr. Cole, you can start sharing your screen and get started whenever you're ready.
Perfect. Thank you so much. Let me see. I'm going to put this in presentation mode. And does everything, hopefully everything looks okay? Does it look okay on your end?
Yep, it looks great.
Perfect. Okay. Thank you so much for having me again. I'm really excited to join Web Shadowers and talk a little bit more about my specialty, as well as kind of networking as a physician or a medical student or even a pre-med. And hopefully this, gives you some tips and advice that you can take with you, even if you're not in medicine, if you're watching this just to gain more knowledge about PM&R and networking. So if you saw my last session, it talks a lot about my specialty and there's a case example. So I took some of those slides and put them in here just to reintroduce myself for those who have not attended my session in the past. And also this presentation, if you're interested, is on my Instagram at dr.cole, C-O-L-E. It's on my Instagram on like a live session. So, there's also that option too, if you don't get a chance to attend this session or you miss some pieces. And then of course we're streaming live on YouTube too. All right. So to begin, what does PM&R stand for? It stands for Physical Medicine and Rehabilitation. So a little outline of my presentation here. I'm going to go into my story, osteopathic medicine, why I chose physical medicine and rehabilitation as my medical specialty, how to network, what not to do when networking, some key takeaways, medical advice that I wish I had known when I was in your shoes. So for my story, the background and everything, I was born and raised as well as educated in New England. I earned a dual degree in classics and biology. And this was really helpful because classics introduced me to Latin and Greek terminology, which is often the foundation for a lot of medical terms that you'll encounter, especially in anatomy. And then biology, of course, I got a lot of my pre-med requirements done through that. So it was kind of like splitting my soul into getting a Bachelor of Arts and a Bachelor of Science, but it was definitely worth it. And it's doable in 4 years. And I was also able to travel abroad 3 times. So if they say that you can't study abroad as a pre-med, they're lying to you. I graduated from an osteopathic medical school. And I did my physical medicine and rehabilitation residency in Philadelphia, the city of brotherly love. And I am the first cancer rehabilitation fellow physician here in Philadelphia. And I actually just graduated last week, so pretty exciting. And a little bit more about my story, why I chose osteopathic medical school for my education. So I loved this quote by Andrew Taylor Still, who was the founder of osteopathic medicine and the philosophy. And he was an MD and a DO. And he says, to find health should be the object of the doctor. Anyone can find disease. And I just really loved that philosophy. And I wanted to embody that as a physician. I felt like the osteopathic medical philosophy just aligned with my own career goals for what I was looking for as a physician. I shadowed a DO as well, and I really liked his interactions with patients. I felt like he was equipped with not just the clinical knowledge and physical exam skills, but also kind of the ability to establish rapport with patients. And he just had so much compassion for these patients. It was like they were family, and I wanted to be that kind of doctor as well. So I did a lot with the American Osteopathic Association. If anyone's interested in learning a little bit more about what it is to be a DO, what it means, and the difference between DOs and MDs. We did have a campaign. It was the DO Proud campaign. So I'm more than happy to talk about this. There's also a lot of information, again, on my Instagram that I included for people who were asking, like, what's the difference? I did end up applying to both MDs and DOs, and I was invited to interview to both, and I chose to go to a DO medical school over an MD medical school. So when it comes to being a woman in medicine as well, I did want to touch upon this. I was fortunate to be part of a healthcare system that celebrated women in medicine and how our diverse backgrounds contributed to the universal commitment of healthcare. So this was actually a picture from my intern year at a community hospital where they also had several residency programs. And I just thought it was a great photo to share that showed kind of the power of diversity and females in medicine. So if you are a woman and you're considering being a doctor, know that there's an amazing group of women out there who are excited to work with you and have you as colleagues. All right. So why physical medicine and rehabilitation? If you were at my last session, you know I love this comic. There's the patient that says, or the doctor asks, "Where's your pain?" And the patient replies, "You're the doctor, you tell me." But truly, it's not always like that, although sometimes it is. I love physical medicine and rehabilitation. I think that it's an amazing specialty that is all about optimizing patient functionality and quality of life. So we are the doctors known as physiatrists, whose goal is to optimize function and improve quality of life. And here, you can see this is an example of a spinal cord injury patient who is learning to walk with some of these, devices that we can train them in. And we work closely with physical therapists, occupational therapists, speech therapists to help these patients get back into their community. And I just remember when I was, I think this might be on the next slide, when I was in medical school, I had done a preceptorship at a rehabilitation hospital. And I remembered seeing this patient who a month before wasn't able to get up and walk. And when I was there, thanks to her physiatrist, as well as the physical therapist, occupational therapist, and speech therapist, she was able to walk across the room and hug her children and converse with them. And I just thought that was amazing. And so for me as a cheerleader, truly I was, and also being a cheerleader at heart, I wanted to be the doctor that motivated patients to move forward in their progress, both mentally and physically. So this is a quick example of kind of what a patient might come in with for seeing a physiatrist. And often we address the neurologic or musculoskeletal issues. We are essentially the non-surgical, in a way, like orthopedic section of medicine when it comes to especially like sports medicine. But there are several other fields that you can go into. For example, I'm in cancer rehabilitation, and I help patients who are dealing with either side effects from chemotherapy or radiation, or they're dealing with issues that are related to their surgeries, or even the cancer itself, whether it's cancer-related fatigue or something called lymphedema, where there's significant swelling of the limbs because there's a disruption in their lymphatic system. But this is kind of a simplified graphic that I liked to kind of explain why a patient might present to us. So they might come in with low back pain, and we can provide them a prescription for physical therapy, or we can prescribe them medical treatment. I personally also like to offer osteopathic manipulative techniques that I learned from my osteopathic medical school training. And depending on the situation, see how they progress. We might need to get further imaging. We might be able to, for example, give them a lumbar support or some other assistive device that they need. We'll check up on them, and there's a lot of continuity both in the hospital as well as out of the hospital, depending on where you're working or what you're interested in terms of pursuing this field if you are interested in this specialty. And then in some cases, we might refer them to surgery. So we might have to do additional workup to see, is this something that needs a surgical intervention. We do, as physiatrists, we do several procedures and such as steroid injections, like epidural steroid injections. We also do trigger point injections. We can do like shoulder steroid injections as well. I do Botox, especially for migraines or spasticity, cervical dystonia, any sort of like tightness that could develop, especially after patients have been treated with radiation, anything like that. And then hopefully at the end of all of this, our patients improve. So why am I explaining this? The majority of people that you meet will not know what PM&R is or what a physiatrist does for their medical specialty. Networking also involves educating and in some cases, advocating for yourself and others. So getting into the second part of this presentation, where to network. There are several places you can network, even if you are a pre-med or if you're in medical school, or even if you're a resident or a fellow, or maybe you're an attending and you're not sure, how do I go about getting referrals for patients to my clinic or anything like that. Conferences are huge. That's where, you're going to meet a ton of people with a ton of different backgrounds who have something different to bring to the table. And I mean, I feel like that's where a lot of advancements in medicine are also kind of made, because people are seeing other people's research and there's discussions and brainstorming, and you can really get this almost like an incubator for innovation. Social media, I'm sure that's how you probably might have heard about this presentation to begin with. So LinkedIn, if you have a LinkedIn, I highly recommend keeping it updated, because depending on your job search or even your school search, they're going to be looking at your LinkedIn profile, and that is your professional profile. And then Instagram, as I've mentioned, I'm certainly on Instagram. If you have any questions, please feel free to reach out and I'm happy to answer them. You can also network with people on Twitter as well as Facebook. I like Facebook because there are a lot of groups that you can join. So for example, there's the Women Physiatrists group on Facebook. And I think that's really helpful with people kind of connecting and brainstorming and collaborating to help with, for example, if a patient comes in and there's questions about, this presentation, and some people might need a little bit of help just from like outside sources, not just their colleagues that they're working with, and they want to kind of ask that question to a whole group of physiatrists, for example. That's a great group to do this in. Didactic. So these are lectures that you'll often attend, especially in residency and even in fellowship. And if you're an attending, you'll certainly be attending these lectures and possibly giving some of them too. So didactics and grand rounds are great opportunities to network. And that's where you can really approach the speaker after they're finished and talk to them. And if you really like what they talked about, or you want to get involved in maybe their research, or maybe they're like, for example, a sports medicine doctor, and they run a lot of the mass sporting events in the city. I'm saying this as an example because this is a true story for me. You want to get involved in helping with these mass sporting events and volunteering at them. You can go up to the attending or whoever was speaking and ask them, exchange email addresses, contact information. So I think that it's really about seizing every opportunity you can to put yourself out there. Don't be afraid to put yourself out there. And that was, I mentioned that example because I used to want to be a sports medicine physician. I used to want to go into dance medicine, but then I decided to go into cancer rehab, and that was also through networking. So I'll get to that shortly. And of course, friends, family, colleagues. I ended up actually finding housing for one of my rotations when I was a medical student through like a Facebook post that I had put out. And it was a friend of a friend of a friend of a friend who knew someone that had available housing in the area I was looking for. And I mean, it was just like really crazy how everything was connected, but it's very true. You just never know like the resources that you have around you, and you just want to make sure that you don't, forget about them, and just keep that in mind. So how Butterbeer helped me become the first cancer rehab fellow physician in Philadelphia. So this is one of my favorite stories. When I was at our medical conference for my specialty, they had an event that was at Harry Potter World, and they had shut down the whole park just for us physiatrists. It was amazing. And I remember standing in line waiting for butterbeer, and I got into a conversation with the woman who was standing behind me. And it turned out that she was a cancer rehab physician in Philadelphia. And I said, "Oh, cancer rehab, I don't really know much about that." And she invited me to spend time with her and learn about the specialty and learn about the field. And I mean, it was literally just standing in line at Harry Potter World, waiting for my first butterbeer, that I found out my future career. And it's just so cool and like such a great connection for kind of how everything comes to be, and like the importance of just always seeing every chance you can as an opportunity to forward your career, because you really never know when it could happen. So how to network? You want to do your research. So figure out your goals and who and what can help you reach them. So, excuse me, after I learned about cancer rehabilitation, I started doing more research on it. I established this woman that I had met. She actually became my mentor, and it was through her that I was able to get electives, and eventually it led to this fellowship. I was able to do research, and it just kind of, culminated in this amazing experience, this great learning opportunity, and just set me up for the rest of my medical career, all because of butterbeer. So then be open-minded. So that's what I'm saying is, wherever you are, just be open-minded. You never know who you're going to meet and what they might be able to offer you, or even what you might be able to offer them. Be assertive, but don't be aggressive. And you want to be an active listener. And I'll talk a little bit about what it means to be an active listener shortly. You want to ask for people's contact information or ask for their business card. I'm sure in this day and age, there's a way to do it electronically, so there's not waste of paper, but I do think it's important to have your own business card. I think having something tangible is very helpful. But if you're someone who wants to stick to more like eco-friendly methods, then you can certainly do something on your phone, and there might be a way to like share the image of your business card or something like that. One tip that I learned for a business card that I thought was really helpful is put your picture on it. And that could be like on the back of your card, or it could be like right next to your name. But I think that having a face next to your name helps the other person remember you a lot better. Okay, so how to be an active listener. So there are 6 key active listening skills. The first is to pay attention, which hopefully you guys haven't been too bored and are paying attention to this. The second is to withhold judgment. Just wait so that you can hear kind of what they're saying and better understand them. And how do you better understand them? You reflect on what they're saying and you clarify if you don't understand something. And then you summarize it and you share, and you can have these shared experiences with another person, and that can help even like grow more of a bond with them. I think this is important too, to put yourself in the situation of you're in a big group and everyone's introducing their names. And at least for me, I get so focused on what I'm going to say. I don't hear most of the names that are going around the room or learning about all of these other people, because I'm so focused on what I'm going to say. And I think it's important to take that moment instead and just listen to what other people say, because it's your opportunity to meet new people. It's your opportunity to network. Some things that can help with that is to, again, reflect, clarify, summarize. So to repeat back even what that person might have said, or ask them, to clarify something. Especially in medicine, as a physician, when patients are complaining about something or telling me about, whatever their issue is that they're presenting with, I often will jot everything down, document it. Of course, you have to write your notes. And then I'll go back and I'll read it to them and I'll say, is this correct? Did your back pain start 2 weeks ago and you're describing it as sharp and achy, and, there's numbness and tingling going down your leg? And they'll correct me if I'm wrong. So that's kind of, going through everything to make sure that I understand it. And at the very end of the appointment, when I'm going through, the different treatment regimens or interventions, I'll teach it to the patient. I'll explain, this is what I would like you to do. These are the imaging or labs that I'd like you to obtain. And then I'll ask them to repeat it back to me so that I know that they've heard it and that they've been an active listener or something like that. So that's the teach back philosophy that you'll definitely learn, I'm sure, in medical school. But it just kind of dovetails off of these key active listening skills that you just really want to be able to master, not just even for being a physician, but overall being, a professional, and especially at a networking event. Okay, so this is my test of all of you for checking if you guys are actively listening. So a little photo bomb for the win. All right, so now what it means to network and how to introduce yourself. You want to prepare your elevator pitch. So this is like a 30-second introduction of who you are, what you do, your strengths, what you can offer to whoever you're introducing yourself to. And it should last the length of an elevator ride. That's why it's called the elevator pitch. So the first step, identify the goal of the pitch. So you want to introduce yourself, as I said, and this is something that you can use whether it's at a networking event or even like, you approach someone after a lecture that they've given. So you would introduce yourself. You might, have some sort of goal with advertisement and building a connection, depending on what it is that you're doing and what your approach is. Clearly describe what you're doing, what you study, research, what you're building or making, and any past experiences that you have. And then you want to focus on your strengths. So any unique ideas that you have, recent activities, any of your latest accomplishments. You definitely want to credit or compliment whoever, has helped you reach these goals. So team members, supervisors, mentors, that speaks a lot about you and your understanding of, what it takes to get to where you are and where you want to go. And then engage the listener at the end with a question. So you want to offer them an opportunity to respond, but you want to make sure that they're responding in a way that's inviting. And so I think asking an open-ended question, not a yes or no question, but an open-ended question can be really helpful. Okay, so now what not to do. So a lot of times, especially in medicine, the way you want to think about this is that you're essentially in a fishbowl. And excuse me, sorry, I should have had some water before I started this. So you're essentially in a fishbowl, which means that everyone is looking at you. And especially in my specialty, it's a small specialty. So you want to make sure that you're behaving professionally and appropriately, because otherwise, it can, in a way, affect your reputation. So while networking events are fun, and they often involve free food, live music, an open bar, in addition to, for example, Harry Potter World, there was another event that we had that was at Epcot, complete with fireworks. So it was very fun. Also an open bar. So you want to remember that you are still in a professional environment. And this includes not just how you behave and what you say, but also how your guest or your plus one behaves and what they say, because these are all a reflection on you. Think of these events and others as though you are in a fishbowl and everyone is watching you. I think the words got cut off. I apologize, but it's a little fishbowl graphic. How do you want to appear? You want to ask yourself that. How do you want to appear? And how do you want to be remembered? That's another important thing to consider. So the key takeaway is you never know who you will meet and when, so you want to take advantage of every opportunity. As I mentioned before, I found housing for my sub-internship rotation at Spalding through a Facebook connection, which was really a connection with a connection with a connection. I did my physical medicine and rehabilitation elective through a family friend who, along with another colleague, both of them encouraged me to get my MBA. And I actually graduate this summer. So I'm happy to answer any questions about getting an MBA as well. And then I landed my dream fellowship thanks to a close colleague, a great mentor, and of course, some butterbeer. Advice for any future physicians out there, or even anyone else who is interested in becoming a healthcare professional, whether it's a nurse practitioner, a physician assistant, or a nurse, I think that, or a respiratory therapist, or a physical therapist, or an occupational, I could go on and on. There's so many great careers out there in healthcare. But the biggest thing is to remember it's a marathon, not a sprint. You have brains in your head, you have feet in your shoes. You can steer yourself in any direction you choose. From The Good Doctor, Dr. Seuss. And this is just a little picture. I used it in my last presentation. I just think it's a little funny, a little true. Dream versus reality of what studying medicine is like when you think you're well rested, healthy and happy, saving lives. But you actually are trying to figure out where your hairbrush is. You're not getting any sleep, which can happen some days. So, really pay attention to your body. Make sure that you're putting your priorities first, and try not to sacrifice sleep, because that is one of the most important ways that you can thank your body. And it's important for staying healthy too. So thank you all for attending. I hope that this was helpful. Again, I'm happy to answer any questions, whether it's on Instagram. I'm also on TikTok, because I do feel like laughter is one of the best medicines. So I like to have a lot of fun on TikTok and share, some behind the scenes of what it's like to be a physician, and also a new dog mom too. And then I'm on Twitter, and I do have a blog, dailydoseofvita.blogspot.com. And I try to post some helpful articles on, for example, how to know which residency program is right for you. This also applies to how to know which medical school is right for you. Tips for interviewing, as well as writing your personal statement. And feel free to reach out if you have any questions. You can contact me through my email, dailydoseofvita@gmail.com. I am a Kaplan Medical School admissions consultant as well, and I'm taking new students. So I'm happy to kind of set that up and discuss everything if you have any questions or are interested. I hope this was helpful, and I hope you're all doing safe and staying well. Thank you so much for attending, and you guys have a really great career ahead of you. So I can't wait to see where everyone ends up.
Thank you so much, Dr. Cole, for the wonderful presentation. We really appreciate all the tips. I know I learned a lot. If you have time, there are some questions in the Zoom chat box that we would love for you to answer.
Sure, absolutely. Let me see. Are you able to read them off to me? Because I'm not sure I'm able to.
If it's easier, you can also stop sharing your screen. And I can.
Okay.
Yeah.
All right. Let me.
Whichever's best for you.
Yes. Perfect. Got it. Okay. Let me see. Okay. So Sophia, where did I attend DO school? So I went to the University of New England College of Osteopathic Medicine. It's up in Biddeford, Maine. And it includes 2 years of being kind of on campus in Maine. I think they're actually moving the campus to Portland. So that's why I kind of hesitated to remember. Like, I think it might be in Portland now. Either way, it's beautiful, right by the ocean. So it's 2 years of being kind of on campus, and then 2 years of doing clinical rotations. And for that, I was over in Western Massachusetts. But there are, like, at least when I was there, there were about 13 other sites that you could go to for clinical rotations. So it's kind of like all over the New England area. And it was a great medical school. I loved it. It was wonderful because they really had integrated kind of learning anatomy with osteopathic manipulative medicine, as well as pharmacology, physiology, histology. So like while you're dissecting the heart, you're also seeing the histology for it. You're learning about the pathophysiology in clinical knowledge courses. So I found that to be really helpful. And also their anatomy courses all year long, which I really liked, because I know there are some that are a little bit shorter, like 5 weeks or so. And I just wanted to make sure that I had a really solid understanding of anatomy. And they don't necessarily use prosections. They do dissections for their anatomy. So you really get a better appreciation of kind of understanding it when you're dissecting for the cadavers. Okay. Once you were in your residency and or fellowship, was it hard to work with MDs and use your manipulative medicine techniques as a DO? No, not at all. In fact, a lot of the MDs asked me to perform OMM on them because they wanted to learn about it, but they also, certainly had issues, somatic dysfunction, myofascial issues that they wanted me to treat. So it was really exciting to teach them about osteopathic manipulative medicine and be able to use it. And where I did my fellowship, they were very supportive of it. And they encouraged my patients to, or they encouraged their patients to seek me out for OMM if they felt like they could benefit. So it was definitely like very inviting, welcoming. I think nowadays, the residency programs have merged. Working with an MD is just similar to working with a DO. It just feels very equal across the board. We just have this additional 250 plus hours of training in OMM. So we have this extra skill right at our fingertips, which is amazing, especially to offer patients because they love it. Okay. Can I give you my elevator pitch? Oh, okay. Let me see. I can do my best. So hi, my name's Alyssa. I'm a physician over in Philadelphia, and I'm in cancer rehabilitation. Let's see. I'm trying to think because it's hard to figure out if I want to. You know what? I'm going to do it as a spin on something that I had worked on for the pandemic. So I had helped to create these antimicrobial gloves. So that's what I'll do it as if I'm pitching that, okay? Because I'm trying to think, like, put myself in that situation, what I would be doing. So hi, my name's Alyssa. I'm a physician in Philadelphia. I'm doing a fellowship in cancer rehabilitation, and really working during this pandemic, I've noticed that it's there has been more of a demand for increasing hygiene, and I've worked with another. This is hard to be doing on this spot, guys. I'm sorry, I haven't practiced it. Okay, let me try it one more time. Hi, my name is Alyssa. I am a physician in Philadelphia. I'm currently in fellowship for cancer rehabilitation, and I've been working during this pandemic, and I found that the community is certainly concerned about what's going on with the pandemic and trying to find ways to combat this and keep them healthy. And as a physician, I really want to extend what I can offer beyond the hospital doors. And so I've worked with a local Philadelphia apparel company to create these antimicrobial gloves. And I think it's wonderful to have them support me, not just through creating this new product, but also helping with getting my MBA. So it's really taught me a lot about business administration. And I would love to know your opinion on how you see this possibly helping your patients and your community at your hospital. What do you think? Something like that. Sorry, that was not as professional as it always comes across. And usually you practice. So I guess that's another thing when you're networking, really practice your elevator pitch. I haven't networked in a while, I guess, because we've been virtual for so long. But just get that 30 seconds down. I mean, I certainly have other elevator pitches for when I was applying to residency that I could go over with you guys if you want. I have those ones nailed down, but it's hard when you're not like in that situation and knowing exactly what you're pitching. So that was a good question. Okay, let me see what's next. Why did you choose to get an MBA, and how do you think it changed your pathway through medicine? So I chose to get an MBA because I wanted to better understand the business side of medicine. I feel like, especially now, a lot of times we are putting profit before patient, and I don't agree with that. And I want to find out, almost like being devil's advocate to find out on their side, why are we doing that and how can we combat that as physicians? I do hope, eventually that I will be able to start my own business. I'm not entirely sure what it will be, possibly like consulting or something. If you guys have any ideas, please let me know. But I do, I wanted to understand the business side of starting your own business as well as medicine. And in addition to that, possibly if I ever decide to go into private practice, I think it'll be a really useful tool. What does a typical day look like for you? So this is a tough question only because it depends what you're asking. If you're asking for residency or medical school versus like fellowship right now, because I can certainly answer for fellowship, and I'm happy to go into residency and medical school days as well. I just don't want to like talk your guys' ear off. But essentially right now for fellowship, I work both inpatient, meaning in the hospital, and outpatient, meaning at clinic. So like if you were to make a doctor's appointment to see someone, you would essentially go to clinic. And so what I do during the week, it varies. Sometimes I work at like different hospitals and different rehab hospitals and also different clinic sites. But essentially what I do is I'll see patients on the acute care side, so in the main hospital, and determine, are these patients ready for a comprehensive rehabilitation? So can they tolerate more than 3 hours of therapy? And if the answer is yes, and they end up over in the rehab hospital, I'll go see them over in the rehab hospital. And there I will, offer any guidance I can, especially from a cancer rehab perspective. So helping coordinate their oncologic care, are they going to need radiation, chemotherapy, any sort of infusions coming up? And so it's almost like acting as a liaison between the two hospitals. And then there's a lot of continuity of care, which is great because I can follow them out. Like once they are discharged from the rehab hospital, I can follow them outpatient into clinic. And there I can see them, make sure that they're recovering well in terms of their functionality, if they need additional physical therapy, occupational therapy, if they have any neurologic issues, musculoskeletal issues, I'll be there to address those complaints. And then hopefully, they'll improve, and it'll be, more continuity in terms of like a long-term, like seeing them every 6 months. So that's kind of my typical week. So that's why every day varies. So it's a difficult question to answer in that sense. But I can tell you, like, for example, today I woke up early. I actually went to clinic with my mentor who I had met, the one who we had gotten butterbeer together. And we had done a couple of procedures. I did a migraine Botox procedure as well as some trigger point injections. And then after that, there was a shoulder injection. So we did a steroid injection for this woman's subacromium bursitis. And then I went to see the patients that were in the hospital in rehab to check in and see how they were doing. And then I went afterward in the afternoon over to the acute care hospital to see any additional patients who, they're still getting worked up in terms of their medical issues, and they're not necessarily stable enough to go to rehab, but they might be a good candidate possibly later in the week or next week. And so I would go in and evaluate them from a medical standpoint and a physiatrist's perspective to see if they would be a good candidate. Hopefully that didn't talk your ear off and it made sense. But again, ask me any questions. There are no stupid questions. So I'm happy to answer. Okay. Can you give an example of how your experience going to DO school has benefited you in your work as opposed to MD? Yes. So I feel like I experience this every day with the way that I communicate with patients, and especially the strengths that I have in understanding their anatomy, their neurologic system, musculoskeletal system. And most especially, I feel like I have my patients that really benefit from osteopathic manipulative medicine. They're the ones who are telling me, like, this is so helpful for me, especially in the cancer population. They have gone through so much in terms of their interventions, procedures, chemotherapies, and they just, they don't want to take any more medications. They just want something else to supplement their treatment. And so I can offer OMM as well. So, I think that has really helped kind of coming in with that more holistic approach. And I feel like that ties in too, even from a palliative perspective, because I feel like palliative definitely overlaps with cancer rehabilitation, and just understanding patients' quality of life and, putting them first and realizing, what they need. And MDs do a great job of that too. But I think the DO philosophy really ingrained that thinking process in me. Okay. What made you choose DO over MD? I feel like I kind of already answered that. So if you feel like you need clarification, just reach out to me, and I'm happy to clarify as well. I might even have a blog post on my blog about it too. What did you do in your study abroad during undergrad? So I studied abroad 3 times. I went to Italy for the first time. I spent the summer in Italy because I was a classics major. I was studying the Mediterranean diet as well as Roman architecture. And then let's see, the second time I went to England, and that's when I studied theater. And that was really just to earn some additional liberal arts credits that I needed for my classics degree, but also just have fun and enjoy it, because my undergrad school that I went to, they had offered like a winter term. And so that's, excuse me, when I went and I was able to do kind of this winter term in England. And then the third time that I studied abroad was actually not just a study abroad, it was an entire research grant that I had gotten. And that was during the summer, and it was in the Netherlands. So it was really incredible to spend time and like immerse myself in this culture, but also, actually, that was the time that I was applying to medical school too. So it was very interesting because I was doing all of this research. It was on eelgrass, so like a seaweed, and understanding the ecosystem and the health of the environment. So it was kind of a niche project, but still very interesting and relevant still today to our ecosystem and the environment. But it was what was really unique about it was I was also applying to medical school. And so I was like trying to figure out time differences and calling up like admissions committees to make sure I was like understanding the process and everything. It's a little hard to do that when you're abroad, but I managed it and I got in and it was excellent. Okay, so let me see. What would you recommend for pre-meds to look for to gain experience for med school? So a few things, and I talk about this in my first Web Shadowers presentation. I would definitely, if you can, do research. I think that is a really great opportunity, especially if you're interested in doing research as a physician. But it also kind of shows, you're interested in advancing the world of science. And then for me, I was also an EMT, an emergency medical technician. So I got a lot of the clinical experience from that training and being an EMT and kind of seeing the, like when you're on the scene and understanding what it means to triage for patients, who are acutely unstable versus, do these patients need to go to the hospital or do they not? And then I was also a volunteer at an emergency room hospital. So it was kind of nice. I got to be on both sides of the ambulance bay. So, like in the ER as well as like outside where the ambulance is. So it was actually kind of funny because I would see some people as I was an EMT, like that I was also working with as a volunteer. So those are things that I did. Surprisingly, I didn't end up going into emergency medicine, which is also an awesome field. But I think, it's what you want to do and what you're interested in. I have worked with students who've been scribes, and I think that's also a really great opportunity to even learn the medical terminology too, and just like how the healthcare teams work together. But I know it's been difficult. I think, the fact that you guys are shadowing now virtually is amazing that you're able to take advantage of these opportunities. So I think, if you can do as much as you can to gain exposure, even just shadowing physicians, whether it's DOs, MDs, I recommend both to understand, their different training approaches and how they treat patients. That can be really beneficial. All right. So how was your first time seeing a cadaver? That's an interesting question. I think like all of us went into the anatomy lab, it was very humbling because these were people, and they donated their bodies to science. And to this day, I know we had done a ceremony right before, just as a way of thanking these individuals and their families for giving us this opportunity. So, I think it was, it's tough, but it's a very humbling experience. And you just feel very grateful for the opportunity. And then it becomes, it becomes almost like a way of bonding you with your class because you're all doing this together and you're learning so much. And the cadavers, they're going to teach you so much. And, just never lose sight of the fact that, this person has given up their body for you to help you be a better physician. So I think that's really important. In a way, it's almost like they're your first patient. Okay, so then for us as medical school applicants, what is the best way to determine the right medical school for us? I think it depends. So I do have a blog that I talk about this where it goes over, how to determine or how to know which residency program is right for you. And it can also apply to medical schools. So I say it's usually 4 things. So location, Where is it located? Do you feel comfortable there? Is it near home? Is it near, a support network that you have? Or is it like a whole new place where you want to reinvent yourself? So location, as well as the size. So the size of the medical school or residency program, depending on what you're looking for. Is it like a really big medical school? Do you feel like you're going to get kind of lost in it? Or do you feel like it's going to be more like a community that, you're going to bond there and you'll have essentially like this academic family? Or, what are you looking for too? Like, is the medical school, do they offer research? Are they connected with a hospital? So location, size, fit. When you go there, I definitely recommend looking at the newspapers if you can, or just like looking online and kind of finding out about the community and what it's like. Some medical schools, for example, are linked. Sorry, my dog's popping up here. Say hi, Wesley. Some medical schools are linked to hospitals and some aren't. And some are also linked to bigger academic institutions. And they might have like more research opportunities. And then let me see. So I said location, size, fit. So do you feel like it fits? Do you feel like you see yourself there? Do you feel like you belong there? Do you see yourself in the students that you're walking by or seeing? And definitely take advantage, if you're on site, ask the students if they like the school. And then the last one is going to be future. So what does the future of that medical school look like? Where have the students that graduated, where have they gone? Did they get into their top choice residency programs? Or, is the medical school expanding? And if so, how is it expanding? What programs do they have going on that, will be available to you in the future? So I think that's a little bit about what I talk about in the blog post. I probably go into a little more detail too. So, hopefully that helps. So those 4 things, I'll repeat them one more time. So location, size, fit, and future. And that applies to residency as well. Okay, so for assessment, what is the best way to determine the right medical school? Okay, I think I answered that one. What was the most rewarding case you've had? So the most rewarding case I've had, I think I talked about this in my very first presentation. So we had a patient who had undergone, she was a cancer patient, and she had undergone chemo and radiation and surgery. And she developed significant numbness, tingling, and weakness to the point that, she was previously able to walk independently on her own. And then she was requiring a wheelchair. She, became completely unbalanced. Sorry, my dog's like messing around with things. They're about to topple over. But she became completely unbalanced. She wasn't able to support herself. And so she needed a wheelchair. And 6 months went by. And then she finally presented to the Cancer Rehabilitation Clinic, and we were able to discern, they had attributed it to chemotherapy-induced neuropathy, peripheral neuropathy, but that was not what was going on. After we had done our whole workup, we found out that it was actually radiation-induced, and we got her in the right program. It was what's called a radiation-induced lumbosacral plexopathy. So you'll learn about the lumbosacral plexus and the brachial plexus when you're in medical school. But essentially what we were able to do was get her into the right physical therapy programs and make sure that she was on the correct medications, especially for the neuropathic pain that she was having, to help her, get back to her quality of life and enjoying what she used to love to do, which of course was walk. And so we helped her go from, being wheelchair bound essentially back to ambulating. She needed an assistive device, but she was still able to get around much better than she was before. And the sad thing was that took 6 months for her to present to our clinic. So that's another reason that it's really important, especially what I'm doing now, talking to you guys about cancer rehabilitation and even just physical medicine and rehabilitation, to make sure that people know that this specialty exists and that we are there to help these patients. So I think it also speaks volumes about the fact that we need more cancer rehab physiatrists. So if you're interested in this field, definitely consider that as a subspecialty. Okay, so let's see. How early does your day start and late your day end as a cancer rehab fellow? A lot of night shifts. How is your work-life balance? Okay, so this is a good question. So actually, it's mostly 9 to 5 for being a fellow, and I'm not on call. I think it just worked out that, especially being like the first one, that's not the case for all fellows. I know like the sports medicine fellows, they have to do game day coverage on weekends. But for some of them, they might have to do weeknight coverage or even weekend night coverage. But for me, I didn't have to. That being said, in residency, that's a whole different ballgame. And that residency was hard. I'm not going to lie. It was hard. You have days where you're working 6 days in a row. And I've definitely been on 24-hour call. It's tough. And that means like you're going from 7 a.m. to 7 a.m. Or some days you might, if it's not a 24-hour call, you might be working from like 7 a.m. to 8 p.m., 9 p.m. So I think it depends. And it also means that you want to find a residency program or a medical school, because you'll be working long days for medical school because you'll be studying. And you want to find a place that, you really get along with everyone, and you feel like they will support you and help you, especially in residency, because there might be days that you get a late admission and you might need help. Oh gosh, you can see my dog's about to knock my lamp over. Okay. So hopefully that helps. And then for work-life balance, I mean, right now it's definitely improved, but for residency, it was tough. Those days are tough and you're tired. And so I definitely made it a point to spend as much time as I could when I was off, like for example, on my post-call days, catching up on things, catching up on sleep, catching up on meal prep and working out. And I do think, one area that I feel like people might not consider is the time on social media. So I do spend a decent amount now on social media, mostly, talking with you guys, making sure that, if you have any questions, I'm helping answer them and helping you guys better understand the medical school admissions process and all of that. But especially when you're in residency or anything like that, you want to maximize your time. And that means, if, for example, I remember there was a really powerful quote I read that was like, if you have time to go on Facebook, or you have time to go on Instagram, or you have time to go on Twitter, you have time to work out. So I thought that was very eye-opening. And that's kind of how I live my work-life balance is like, if I have time for, Netflix binging, then I should have time to work out. And that's where you just, it's all about maximizing your potential and making sure that you're not wasting your time. Not that I think those things are a waste of time, because I think it's still helpful, to have those opportunities to just relax and kind of do what you want to do. But I think it's also important to put your own physical health first too. Okay. Let's see. What specialties would you suggest for someone who doesn't want to be in research and wants to focus more on being a physician? So, oh my gosh, if this lamp gets knocked down, I apologize. So, for that, I think it could be any specialty. I think the question would be more, where would you practice? So in that case, you might be more interested in practicing in like private practice rather than an academic institution, or you might be more interested in practicing at like a community hospital rather than like a big academic research institution. How do you ask, and when should you ask a DO for a recommendation after shadowing them? So I would say I spent maybe like 2 sessions. I think they were each 4 hours, so 2 afternoons shadowing a DO. And when you shadow someone, they understand and they know that the goal is, of course, to figure out next steps to get into medical school. And oftentimes they know that you're going to request a letter of recommendation. So I wouldn't, certainly start off like that, but afterward get a feel for, how it went. Do you feel like you have a solid relationship with them? For me, I made sure I actually wrote up questions for the attendings that I was working with. And I ended up printing them out, and I had my little paper and pen, and I brought it with me. And at the end of the workday, I asked them, do you have a chance to chat? And I went through my questions and I wrote down their answers. And questions, for example, would be like, what would you tell your past self if you could? Sorry, my dog's still like about to knock everything over. So what would you tell your past self if you could, before you like went to medical school? Or what advice do you have for a future physician? Other things that I would write down would be like, what was the most difficult experience you had in your medical training? Or, can you tell me about a challenging patient? And these are also good interview questions that you should prepare for yourself too. So I would have those handy and write them down. And I feel like even just having that conversation was really helpful to have that me get to know them, but also, a chance for them to ask me questions and get to know me and understand where I'm coming from. So, at the end of that, I think that's when you would ask them for a recommendation, and you, excuse me, you could do it in person, or you could wait a couple of days and like do it over an email or something, if depending on, how responsive they are to emails. Okay. Let's see. What specialties would you say? Okay, I did that one. How do you add? I did that one. What do you think is the quality that med schools look for the most in prospective medical students? Okay. So, essentially medical schools, they want a well-rounded student who is going to be able to rise up to the rigor of this academic curriculum that, they're about to enter into, because medical school, as I said, is difficult. But they're also looking for someone who's personable. And I think the biggest characteristic they want is someone who's compassionate. I think if you can show how compassionate you are and, of course, back that up with everything else that you're bringing to the table, from, your academics to the activities you've been involved in, then they just want someone who's going to be there for the patient and put the patient first. When I started medical school, they gave us this little pin for our white coats that said IATP, and it stood for It's About the Patient. And that was day one. From day one, everything we did, from anatomy, dissecting the cadavers, to studying all the slides that we went through, it was all for the patient. And so that's what they're looking for. So they just want to make sure that, you're invested in it as well. Another good characteristic to have would be good time management skills. But that's not, I think that's important. But just a key thing to consider and just work on and practice if you can now before you get to medical school. Okay, are there any specific training experiences or content you wish you received in undergrad that would have helped you further in medical school? That's a good question. Honestly, when I got to medical school, I was like, what have I been learning this whole time? Because I feel like medical school, it's just, there's so much information, and you just feel like you wasted like the last like 4 to 8 years. Like you should have gone straight from, middle school into medical school instead of gone through like high school and college and all of that. I kind of felt that way a little bit, but, I think definitely, of course, taking all of the pre-med required courses, because you want to have that foundation, is very important. And then definitely taking advantage. I feel like I don't have any regrets from what I did. I know some people took some time off to either do a different career that they might have been interested in, or travel, or do something else. But I made sure to do that while I was still in college. So I think that, it depends on what you're looking for and what you're interested in. I guess the only other maybe specific training that I would have liked to have before medical school, or even just before residency, would have been like phlebotomy. It would be nice to just like understand and know kind of like how to, get IVs started or draw blood or anything like that. Because the majority of the time it really is the nurses. They are the champions. They know how to do this. It's rarely the physicians, at least, from my experience. That and my specialty that would do that. But I wish that I at least had like a stronger foundation in it, so that if there was an issue or something, I could help the nurses a little bit more than just like being like, I'm sorry, I don't really know how to do this or what to do. Can you help me address this? So I think that would have probably been helpful. Okay. And it's never too late. It's never too late. I can still learn. All right. Have you encountered any women in medicine who want to have children in the future, and how they think of making this happen while being on this journey of being a doctor? Yes, no, absolutely. I a few of my best friends have had children while either in medical school or in residency. I mean, I think it's probably a better question for them just because they went through it. But, I think that it's absolutely possible. I know some who've done it even alone without a partner or anything. So I think that, if it's something that you are looking into or interested in, that's definitely worth pursuing. And I don't think that it's something that like you should put off or wait if you feel like the time is right and the time is now. A great example, not that this is necessarily analogous, but throughout medical school and residency, I really, really wanted a dog. I actually started working for WAG. I was moonlighting for WAG as a dog walker while in residency. And I remember even my colleagues were like, are you sure you're a doctor and not a veterinarian? Because I was spending so much time with so many different animals. And I understood that my schedule at that time was not conducive for me to have a dog. And I also wasn't in the right time of my life to have a dog. But then when fellowship started, I started to feel like I could take on this additional responsibility. And I did my research and I talked with people. One of my best friends is a veterinarian, so I was able to really, talk to her. So I think definitely doing your research and talking to other people about their experiences. And then I just started applying for rescues and eventually found who you saw earlier, my puppy. So I did join the pandemic puppy bandwagon and I got a beautiful Aussie lab mix. And he has just been wonderful. So, I'm really glad that I didn't delay it any further, but I'm also glad that I waited to do it. But I did it, while I was still getting in medical training. So, I think it just takes having like a good support network. I had really good dog walkers who could help me. So I think, that's something to consider. And then again, doing your research, making sure that you're understanding it. But sometimes people don't even do their research and it just happens and, it's meant to be. So I don't think that you should think of this as a barrier or anything like that. Okay, so do you know of any tips for high school students looking to go to medical school or high school students applying to the Bachelor of Science MD programs? So, I mean, even in high school, I would say take advantage of any opportunity you can. I remember when I was in high school, and when I say opportunity, that means like to get involved in clinic experiences or shadowing experiences, or even just, learning a little bit more about research and science or, what you're interested in. So I would say, like for me, I remember I attended several summer programs that were very focused on either research and science, or I even attended one that I studied antiquity. So that kind of led into my classics. So, I mean, I think it just means that if you have a passion, for example, for theater or dance, like definitely do that. And you can bring that to the table when you're applying to medical school and say, I have this really strong appreciation for anatomy because I understand how the body moves and the mechanics of it, especially with my background in dance and, pushing past these barriers, the anatomic, I mean, you don't want to push past the anatomic barriers, but, just kind of like explaining that, can certainly set you up for that personal statement, whether it's applying to college or applying to medical school after. I will say too, if you're in college right now and you're going through these shadowing experiences, write them down. You want to write those down because those are great experiences that you can call upon when you are interviewing, or if you're trying to brainstorm what to write for your supplemental essays or your personal statement. Those are the experiences that you want to show. You want to show them. You don't want to tell, you want to show. I can get into that a little bit more later too. At some point, I'm sure I could probably do a lecture on that as well. But I think we're a little after 8 o'clock. I hope I answered your questions. And I'm sure I got a little tongue-tied in there at some points, but hopefully this was helpful.
Thank you so much, Dr. Cole. This was a wonderful presentation, and we really appreciate you taking the time to answer all of our questions. They were so informative. We really appreciate it.
Of course. Thank you again for having me.
Of course. And for all the viewers, The Google form has been posted in the chat box of the YouTube video, and it will be posted in the description of this video shortly. So make sure to fill that out in the next 30 minutes. And once again, thank you so much, Dr.